Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Eliza Andrews, who is the owner of InSpirit Therapy Associates based out of De Pere, Wisconsin. As a physical therapist and pelvic health clinical specialist, Eliza considers herself a puzzle solver for her patients, and she loves helping people find the root cause of their symptoms. She discovered early in her career that a whole body approach was the key to quicker recovery, so her practice combines traditional treatments with lifestyle management, nutrition, and emotional support. In 2009, Eliza became one of the first PTs in the nation to earn the Women's Health Clinical Specialist designation, and she has been a leader in the pelvic health therapy world ever since. When Eliza is not helping patients, you can find her working on a DIY remodeling project, reading, or spending time with her husband, kids, or grandkids. In our 4 episodes together, her experience of over 30 years shines through as we discuss numerous topics related to pelvic health therapy, including an overview on what pelvic health therapy looks like, symptoms specifically related to kids like bedwetting and constipation, how pelvic health therapy can help treat reproductive challenges such as endometriosis or irregular or painful periods, and how pelvic health therapy can be a game changer for women in the childbearing years. Get ready to learn a ton? Here we go with today's conversation. Welcome back to the podcast. We are here with our 4th episode with Eliza. Welcome back.
Thank you.
All right, today is a day you've all been waiting for. We're about to talk about what pelvic health therapists are most commonly known for. And I feel like this is even more recently common that women are thinking about going to therapy as just like their next step after they have a baby.
Mm-hmm.
So we're going to be talking about anywhere from trying to conceive through postpartum and how you can be a really awesome advocate during that time frame. But you recommend that a woman starts her therapy appointments before she even gets pregnant. So Why and when would she start?
I think the important thing is that, first of all, let's be clear. Pregnancy is a wellness state. It is not an illness state. So you're not coming in because something is wrong. You're coming in because you just want it to be the best that it can be. That's how I look at the whole thing. So if a woman knows that she's planning a pregnancy, and let's be honest, most of us try to, don't always work out that way, but we try because we're trying to fit it in between certain things happening in our lives or whatever. If you know that and you come in, you can get the right muscles strong, which will help improve how you feel during the pregnancy. We can talk about strategies for hydration, nutrition, improving posture and sleep and all those kinds of things. If there's any underlying problems, if someone does have a history with endometriosis or difficult periods, if they've been on birth control for a long time and there might be some hormonal imbalances, there are some things we can talk about nutrition-wise that will help with that. And we can work with people who've had a history of infertility and help mitigate that a little bit. So I like to have them, you're coming in for 1, maybe 2 visits, and so that we teach you a whole lot, it's a lot of education, and then give you some very focused exercises and provide you with resources that help you get ready for that initial foray into getting pregnant.
I just love that you you can empower somebody before they even get pregnant, especially if it's their first one. I feel like that is that's just amazing.
Yeah. There's so many questions that people have, and when they get pregnant and, or they're like, well, how's this going to be? Or how's that going to be? And we'll answer as many of them as we can. I have little secrets about, well, if you start taking like ginger's my favorite one for combating morning sickness, right? So, but don't wait until you're nauseous.
Oh, sure.
Start doing some ginger tea as you're trying to get pregnant so that your body recognizes that and it mitigates some of those hormonal changes that make your gut go.
Okay. And there's a lot of questions, especially as first-time moms, that you don't even know what to ask. You have no clue what to ask. So I love that, because then people can just come and you can like tell them, hey, this is the stuff you're going to want to know before they even know.
Well, and they'll make the mistake of, I got pregnant, and they'll stop exercising.
Oh, right.
Oh,
Yeah.
terrible, terrible, terrible mistake. And part of it is because they feel lousy, but most of
Right.
it is because they think they shouldn't. Well, I'm pregnant. I have to protect the baby. Or what if I do a sit-up, is that going to squirt the baby out? No,
boy.
it's
We're gonna
not.
say a lot about
It's
that.
not.
Yeah.
But so I love that if they come firsthand, I can get rid of a lot of the myths and the mistaken ideas, things that their mother or grandmother told them, something they got off the internet that's inaccurate. So it's just a big education piece.
Okay. And then would you, at those appointments, would you schedule like appointments for them during their pregnancy at some point? Like if they're, or
once they get pregnant, so we can treat them at any point in the pregnancy. We don't typically see musculoskeletal stuff until second trimester, but there's a few exceptions to that. If somebody has a previous condition, they've had a problem with a hip before, or they've had a weird, they've had something else. There might be a back surgery or a chronic back condition. We might have some things show up a little bit sooner. Every once in a while, I get someone at 13, 15 weeks that's having some symptoms, and we certainly help them with that. But most of the time, it's usually right around the start of the second trimester that we start to see stuff creep up.
Yeah.
Do you feel like pelvic health therapy can help with a woman having a good chance of getting a successful VBAC?
Oh, yeah. That is probably one of my favorite things to do. When a woman has had a cesarean and they want to VBAC, which is vaginal birth after cesarean. There's also a term called TOLAC, which is trial of labor after cesarean, which is when they're not sure if they're actually going to deliver, but they want to at least go through labor. Coming to a pelvic health therapist is really going to help, because we teach them how to relax their muscles correctly, because most often that is what did not happen during the first delivery attempt. And then we teach them how to strengthen those muscles. We teach them how to properly push. I can't tell you how many times women have said to me, yeah, that's not what I was trying to do the first time.
I bet.
And they come in and they like, if I had learned this the first time, it would have been different. Maybe it would have been, but we like to think that if we teach them how to do these things now, their success rate is good. I've done, I think in 2025, we had 8 successful VBACs.
2024?
Or 2024, excuse me. We had 8 out of 9. And the one that did not, it was the infant, there was an issue with the infant, and it had nothing to do with mom. It was something that baby needed to be born, that baby needed born now.
Sure.
And the doctor said, you were doing great. It was just what happened. So we had some good numbers come out of the clinic this year.
Yeah,
That's
absolutely.
amazing. Now, you were talking about how you can help with a lot of the aches and pains that women commonly get during pregnancy, especially in second and third trimester. I know even leaking can start during pregnancy, and that's something that you can help with. But by the end of third trimester, how often are you seeing a woman to keep her, aligned, comfortable, strengthening, things like that? Like maybe even just walk us through the entire pregnancy journey.
Sure.
What should someone expect from a number of visits perspective?
So it kind of depends on, when we start seeing them. So if the average start date is somewhere around 24 weeks is kind of when I see it. That's just a real comment. Oh, my back is sore, my hips are sore, my pelvis is sore, that kind of thing. We'll see them if they're in a lot of pain. If it's sharp pain, we might see them twice a week for 2 or 3 weeks to get things under control. And then we'll see them once a week. As long as they're doing well, we only see them as needed during the duration of the pregnancy. At about 34 weeks, we have them come in with their partner, anyone that's going to be in the birthing suite with them. is invited to come to that appointment. And we go through a whole series of all the ways you can help support her while she's in labor.
Wow.
We do
amazing.
partner teaching. We'll show positions. We'll show massage techniques. We'll show pressure points. We'll talk about all the pluses and minuses. We give them some little tips on navigating the nurses.
Yeah.
We'll give them little tips on things to bring to the hospital. We do all of that. And that is in addition to whatever they might be doing for the birthing classes. And we love having the partners put their hands on, and we actually teach and do all that kind of stuff. So we do that at 34 weeks so that then they have homework to go home and work on together. And they have a little schedule of make sure you practice this, make sure you practice that, so that the partners are ready to go.
And confident too.
Yeah.
Now, this is probably not something you would find at any PT clinic, right? This is because you have a passion for this and you're specialized in it. This isn't.
Yeah, I mean, I think there might be some, I'm sure most pelvic health therapists can do some of this. I just think it's really important. And I've labored 4 times. So, and did end up with an emergency C-section with my last one. So I've kind of just been there, and I just know how important it is to have that support. So, but at the end of the pregnancy, we'll see them. And I've seen some women, they're 41 weeks or 41.3 or they're 42 and struggling. Our moms of multiples, we might see a little more often because they tend to have a few more issues. So if you're a mom of multiples, our twin and triplet moms, we're seeing them a little more often, especially at the end.
Well, then after birth, how quickly do you see a woman afterward? And it's probably up to her for the most part, but what's like the earliest that you would see someone?
We will see, I've been known to visit hospital beds.
Oh my gosh.
It's just my thing, but every one of my moms that leaves with my cell phone number. So if they need me, because you never know what's going to happen. But I had one in May. She called me. I knew she was in labor because she texted me she was in labor, and she texted me at like 3:00 in the afternoon. She's like, I can't do this. So I'm texting her. I'm like, yes, you can. Like I was cheerleading her from my office. And like 10 minutes later, I'm like, do I need to come there? She was at Bellin. I'm like, do I need to come there? And she's like, I got this. And then half an hour later, I got the text picture of the baby. So,
okay.
Cause I was all ready to go. I'm like, if you need me to come hold your hand, I will. But we will see them postpartum as soon as 2 weeks with a vaginal delivery, and sooner if they need me. I mean, if something's going on, they can call me. And with a C-section, 4 weeks.
Okay, so how would a PT, the sequence of PT appointments after birth, how would it look different from a woman that gave birth vaginally versus cesarean?
The only difference is that we start them a little bit later. We just let the tissues heal a little bit more. But again, if someone had a cesarean section and there's something going on, depending, and they call me, there's just things they're just like, obviously we're not going to work on the scar
not yet.
Before 4 weeks,
No.
things like that. But yeah, and we do have them come in sometimes earlier. So it's depending on where they are at physically is where we start. And there's some women who don't want to do any kind of pelvic floor work until they've had their 6-week check. We'll do all the external stuff, first.
Mm-hmm.
Sure.
Yeah, and like we talked about in episode 1, if you guys did not listen to that, we did talk about internal exams and how they do not need to be scary. And Eliza walked us through a little bit about what that looks like. So if you're interested in just learning about what an internal exam might look like, which is always optional, of course, but just go back to episode 1 and make sure you listen in so that you can be prepared and understand what that might look like. But another question regarding postpartum is, do you feel like every woman should see a PT, whether or not she's experiencing symptoms like pain or leaking or heaviness?
Oh yeah, absolutely.
Why?
So you've just been through a big deal. Like it's amazing. And if we started the list, and you guys know this, of all the changes that happen when you're pregnant, your cardiovascular status changes, your blood flow changes, your tissue elasticity
Hormones,
changes.
all these
Yeah, your rib cage goes from 60 degrees to 130 degrees in the angle. If you wonder why your bra doesn't fit quite the same, there's a reason why. Your muscles, of course, your pelvic floor muscles have been through something. Your GI system is like every system has changed, and it's a lot to come back from that. So a pelvic health therapist is going to come in and not only help you with the muscular part of it, but they're going to talk about all of those changes. Postpartum physiotherapy is what they call it in other parts of the world, is a standard of care in other countries. A few years ago, I had a young lady come in to see me. She was after the birth of her third child, and I'm talking to her, and she was great. Like, her pelvic health was great. She had no symptoms. She didn't have any incontinence. She didn't have any heaviness. I think she was 6 or 7 weeks postpartum. And I'm like, well, you're doing amazing. I'm like, is there something in particular that you came in for? She's like, no. And she had a very bad, my accent will be terrible, but she was from France, and she was here with her husband. And she said, in France, if you don't go to physio, bad mama.
Oh.
And I love that, because that's the expectation, is that no matter whether something's going wrong or not, you go and you get checked out.
That's
and
amazing.
what they want and what the expectation is that you help them get everything, you get them as healthy as they can get, and that physical therapy, occupational therapy, that we are the vehicle for getting you as healthy as you can be. If your first baby went amazing and your recuperation from your first baby went amazing, it's going to be different maybe with that second one.
Right.
And the other thing is, you might think everything is great, but it might only be like 75% of where it needs to be. And if you get that little bit of a percentage improvement by having some education and learning what you should do, then that next subsequent pregnancy is better. And the other thing is, or if it's your last baby and you're like, well, everything's okay, when the next big life change hits, then you'll find out what you didn't fix.
Well, and I was just going to say that, because as personal trainers in this realm, that's something that we would see a lot, is people who didn't do PT, they're getting back to whatever their pre-pregnancy fitness was. 2 years down the road, they have a backtrack because of an imbalance that if we would have found that, if they would have seen somebody early,
Right.
it could have been helped, and then they would have avoided an injury or whatever it was.
Well, the advantage too is when you are recovering from, and I use that term because it's the term we use, but like after you've had a baby, your body's in this wonderful accelerated, like healing kind of get me back phase, and your body's doing all these great changes. Take advantage of that.
Yeah, that's true.
Like,
it's a great moment to
saves
just
you.
reset any bad habits you've had in the past. And
You can come out of pregnancy like better, stronger, better posture.
You can.
Less pain.
If anyone wants to pay attention, if you look at some of the Olympic athletes, they have their best performances the year after they have a baby, especially in the track realm. Do some research on that. And it's because the cardiovascular benefits that you get of being pregnant improve your overall fitness. So if you just had a baby, this is the best time in life to get in shape.
That's
that's such good perspective.
So then you need to call Drea and Brit.
One other question is, I think when people think of physical therapy, it's coming in, seeing you, and then having assigned some like at-home exercises. But when you have a newborn at home, and maybe even a toddler or a couple other kids, this is a very exhausting time frame of life.
Right.
So like, what are the expectations of at-home exercises or other things that they kind of need to build into their schedule from postpartum specific pelvic PT?
Yeah. So first of all, we welcome all of those people in our clinic space. So bring the baby. In fact, we get a little pissy if you don't bring them. But bring us the babies. Bring your toddlers with. We are good with that in our facility. We are set up to handle that. But on top of that, the expectation is little bits do lots of bits. So we break it down. It's not 30 minutes of laying on a mat and here's something you can do while you're breastfeeding. Here's something you can do while you're making lunch for your toddler. Here's something you can do while you're going to go for a walk anyway. Well, here's how to incorporate a few more things while you go for that walk.
So doing things that you normally do, but then adjusting it or
amping them up
a little bit, adding a teeny little bit, or just changing it up.
The other thing is we really do teach our mamas about self-care. Like we preach that hugely. And I think it's a great I'll call it excuse, but reason. If she looks at her partner and says, you know what, I have to do my physical therapy, like I'm going, what a great excuse to go sneak off for 10 minutes, even if it's just to breathe and do your pelvic floor exercises. But we do, the majority of them we incorporate into little bits and pieces so that they can just work them into their everyday.
Society tells us that leaking after you have a baby is normal.
Ugh.
I know. We know it's not. It's common.
It's common.
But it's not how your body should be for the rest of your life.
Correct.
So I guess one question is, should we, after going through pelvic health therapy, should you feel the same as you did pre-pregnancy? Or are there going to be, because you did have a baby and your body went through so many changes, are there going to be some changes from how you felt pre-pregnancy?
Yeah, there's going to be some changes. And it's going to be different, but it doesn't have to be bad different. And
like
I think,
you talked about, you said you can be stronger than ever.
You can be stronger than ever. You can, and there might be things that you didn't know you needed to address that you can address now. But I think the other thing is learning how to embrace each phase of who we are physically is really important. And it might different if you're, a 20-year-old versus a 30-year-old versus a 40-year-old having your first baby. Like all of that matters. So, but absolutely, there should be no pain with intercourse. There should be no leaking. There should be no feelings like you can't hold a tampon in. There should be no feelings like, oh, my back hurts. Oh, my back always hurts. Or, oh, my hips. No, none of that. And so it is really important to get those things checked out so that you can work on them. If you had a separation of your abdominal wall muscles during your pregnancy, you should not look like you have an alien baby every time you sit up coming out of your belly wall. Like that can be fixed. Hernias can be fixed, all of those things. And a lot of those things can be fixed without surgery. You don't need to run and get surgery if you have a prolapse or if you have a hernia, or I mean, there are some that sometimes surgery is going to be necessary, but a vast majority of them do not require those kinds of treatments. So if you spend some time finding a pelvic health therapist, they can assess that for you. And whatever they can't help you improve, then they'll help you find those providers that you need.
Perfect. Yeah. Well, these were all 4 of these episodes were really insightful. And we just appreciate your expertise and your experience and you just sharing this knowledge with all of us. So I think to finish out all of our time together, I would just love to ask you, why do you love being a pelvic health therapist?
It's not what I set out to do with my career when I was an 18-year-old, college freshman. But it has brought me so many opportunities to help people that kind of fallen through the cracks. I love it. I love when a couple comes in and they're pregnant and they've been trying to do that for years, and I was part of that. Or when a mom comes in and she successfully delivered that baby that she was terrified of trying to deliver. I love helping the older ladies who, just they don't want to leak because they're embarrassed or they've stopped doing things. I love helping the kiddos who are bedwetters and can't poop. And the men, we didn't really talk about the men much, but, gentlemen who want to have their sex lives back, or they want to feel strong and still, virile in their older age, all of that. And I really love the fact that as a physical therapist, I can help people in so many different ways. Our careers have expanded. We do nutrition, we do lifestyle management, we do stress management, we do some mental health coaching types of things. So I don't know. Every day I get up, I love going to work. I love my team. I love my patients. I tell people I'm just so blessed that I got to do this for my entire life. I am 52 and not looking to retire anytime soon.
No, in fact, we talked about how you're expanding still.
Yeah, we're still expanding. I know. But I love it. And so it just really fills my cup every single day. And for me, it's what God put me here for. And He is part of every single thing I do all day. And it just feels really fulfilling.
I love that. Thank you so much for joining us.
Absolutely. Thank you for having me.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.